Hi, I'm Gardner Goldsmith, founder of the Liberty Conspiracy, found on the interweb net thing at libertyconspiracy.com, because freedom is definitely out of vogue nowadays. And this is part 2 of a video series that I'm producing in order to explore the reasons, the history behind government getting involved with the provision of your health care. How did this all happen? How did we get to a point where the U.S. government is getting ready to possibly take over healthcare or push out private insurance companies entirely? Well, when I think about this, I'm reminded of a quote from Charlton Heston in Planet of the Apes when he plays Taylor and he turns to Dr. Zaius and he says, "How in hell did this upside down world get started?" And indeed, it is an upside down world. Imagine American citizens ready to give up the sovereignty over their own bodies and how they take care of them to the government. It's unfathomable. It's even more shocking when you think about the fact that over 200 years ago, a revolution was started over things that were much more innocuous. And this is people's very existence we're talking about here. It's amazing. And I think it's incumbent on us, we who believe in individual liberty and leaving our neighbors alone, to explore how we got to this point. And so what I'm doing here in these videos is I'm setting up a series of historical points so that you can refer these to other people and tell your friends about them, and hopefully they'll be worthwhile. So I've set something up here for us. It's a little history walk. And what I'd like to do is take you down this path. It'll lead to a really pretty destination, and that'll sort of end the video for you, as I describe what I have explored in my research as the foundational problems that have come about through government intervention of the healthcare marketplace. So let's go together. A little color Blair Witch Project, shall we? Okay, I think the first thing we need to point out is that we need to understand the concept of rights that was understood by those who set up the rules for the U.S. government. According to the founders at the time, and John Locke, the philosopher upon whose work they based most of their philosophy, rights are negative in nature. You have a right to be left alone by me. I have a right to be left alone by you. You don't have a right to anything because that means you can enslave someone else to have it, right? Now, the founders also recognized that people were not only born with what they called rights, people also had certain inherent rights and interests, and they worked in myriad fields of endeavor, entering into market exchange with one another to get what they wanted. And with competition and refinement of their work, guess what? Yeah, they became more productive. They used fewer resources, and they bettered their standards of living. Now, healthcare is just like every other service. You don't have a right to it, either through enslaving a doctor or enslaving your neighbor to give you the money to pay for the doctor. Health insurance is the same, and no one has the right to tell you or anybody else involved in the health insurance industry how to do business. Insurance is a hedge against future liability, and people buy it or sell it based on the calculations regarding the risk that they see of becoming sick. Now, if you're a hemophiliac, diabetic skydiver, you should pay more for your health insurance. Why? Because you're going to cost more. You have heavier liabilities. Okay. Well, anyway, how did we get to this point? Well, it stems from a lack of understanding of one major concept of the Constitution, and that is what's called the Interstate Commerce Clause of the Constitution. The Interstate Commerce Clause was written to stop states from imposing tariffs on one another. Unfortunately, since the time of, maybe the late 1800s into the early 1900s, it was interpreted very fully by many politicians to mean that anything going over state borders could be regulated. And so this is point number 1. All right. Now, the guy who did the majority of that regulating in the early 1900s was FDR. FDR thought it would be a really good idea to impose wage and price controls on businesses. You see, he would mandate to these businesses that they couldn't pay people more than a certain amount. Well, when you do that, the businesses try to change their behavior. And what they do is they try to provide non-monetary compensation to people in things like, oh, I don't know, health insurance. And so you start to get the tradition of businesses offering health insurance to their employees. And FDR is responsible for tilting in that direction. Now, when you get businesses offering health insurance to their employees, what tends to happen is people start to think of the tradition that when they get a job, they'll get health insurance, right? All right, absolutely. Now, what happens then? Throughout the decades between the 1940s and the 1970s, more people started to think about, oh, well, I get insurance with my business. And what happens? Well, individual policyholders decline. But it's not just because of FDR's actions that this occurred. It's also because in the early 1970s, our pal, the incredibly wonderful and honest Ted Kennedy, introduced a piece of legislation that would tilt the balance for group insurance plans bought by businesses. And that was a tax write-off for businesses. If they got insurance for their employees, large businesses, they could write it off. Now, if you're an employee of a large business and you know that you could get your health insurance yourself, but you'd not be able to write it off in your taxes, or you could get it through your business and your business is providing it to you for relatively less, what are you going to do? Of course, you'll get it through your business, right? Absolutely. So that's what started to happen. Now, due to time constraints, we're going to cut things off at this point. But when I return, I'll tell you a little bit more about how prices started to rise even further for health insurance carriers and for the people who pay the policies, and how the United States government and the various state governments, contrary to their state constitutions and the U.S. Constitution, drove prices even higher. Meanwhile, I just want to let you know we're at our destination. This is a beautiful spot. It's a quarry not too far from my house, where my brother, my sister, my niece and I, my dad, my mom sometimes would come up, enjoy the water, enjoy the view. It faced southwards, you can see, so the sun and the moon just go right across the sky. It's absolutely beautiful, a little higher up than that. And there are even little fish in there. Catfish, goldfish, so the little kids dropped off goldfish here. Now, this spot is a spot where my brother and I used to have a 4-mile running route, and it was so much fun. We would come back from the running route down that trail that I just walked. We'd come flying up here, take our shoes off, and splash right into the water. We'd dive in. It was so much fun, sweating like crazy in the summer. Just felt so good. Sort of must have felt like the guys in Planet of the Apes felt after they found the water after being in the desert for so long. So I just want you to think about something. See all the rock along that wall there? Well, as I mentioned, this was a quarry. This was a rock quarry. They hit a spring, it filled up. But a lot of people worked really hard to get the granite out of here. And they did it for commercial reasons. We who believe in freedom are going to have to work just as hard as the guys worked in this place to try to make sure that we defend the principles of liberty. It's going to be hard work, but I think it's important. So I hope you'll spread the word. Remember some of these principles. Interstate Commerce Clause being abridged, completely overlooked about what its real meaning is. FDR imposing wage and price controls, and then businesses being inspired to find some other way to attract their good employees. They have to compete to get good employees. And then later, Ted Kennedy pushing for the tax breaks for large businesses to get group coverage. Now, there's more involved with this, Medicare, Medicaid, and things like that, driving up costs. We'll talk about those more in the future. We'll talk about state policies as well. In the meantime, I hope you'll go to libertyconspiracy.com, check out our website, and talk about this in the forums. This is a very important time, and we can work really hard to try to defend freedom. Just remember how hard people worked in ages past. So, until next time, I'll be seeing you